Does Botox for OAB cause urinary retention? Imagine finding relief from the constant urge to go to the bathroom, only to face a new challenge like difficulty emptying your bladder. That's a question many people ask when considering Botox for overactive bladder. Botox, or onabotulinum toxin A, is used to treat severe bladder urgency and incontinence when other treatments haven't worked. It works by relaxing the bladder muscles, helping reduce those sudden urges and leaks. But because it relaxes the muscles that help you urinate, some people might experience urinary retention. Urinary retention means the bladder doesn't fully empty, which can cause urine to stay in the bladder after you go. This side effect is usually temporary and not common in everyone. Studies show that between 4 and 17% of patients might experience some level of retention after Botox injections. For example, in clinical trials with a dose of 100 units, about 6% of patients needed temporary catheterization to help drain their bladder. Higher doses, like 200 units, have shown retention rates up to 21%. Most cases of retention happen shortly after the treatment and tend to resolve within a few days or weeks as the Botox effect wears off. During this time, some patients may need to perform clean intermittent self-catheterization, which means inserting a small tube into the bladder to drain urine. The good news is that most people regain normal bladder function within several weeks. Certain factors can increase the risk of retention. Men are more likely to experience this side effect, especially if they already have a higher baseline residual urine volume before treatment. Patients who receive higher doses of Botox or have a history of incomplete bladder emptying are also at increased risk. Besides retention, other common side effects include urinary tract infections, painful urination, blood in the urine, fatigue, and discomfort. From a bladder health perspective, Botox can be a game changer for many people, significantly improving quality of life by reducing urgency and leakage. However, it's important to discuss the potential for urinary retention with your healthcare provider beforehand. Proper patient selection, dosing, and post-treatment monitoring of residual urine help manage this risk effectively. In the context of bladder cancer, Botox injections for overactive bladder are generally considered safe and do not increase the risk of cancer or interfere with cancer treatments. Still, any new or unusual urinary symptoms after Botox should be checked by a healthcare professional to rule out other issues, including malignancy. In summary, Botox for overactive bladder can cause urinary retention in a small percentage of patients. Usually, this side effect is temporary and manageable with proper care. If you're considering this treatment, make sure to have a thorough discussion with your doctor about the risks and benefits, and follow their guidance closely. Remember, individual experiences vary, and personalized medical advice is always the best way to ensure safe and effective treatment.